welcome to my channel. This is Dr. Wala. We're going to continue our talking about diabetes and diabetic emergencies, and today's section is going to be about hypoglycemia, which is a very common complications of diabetes. So what is hypoglycemia? Hypoglycemia, it is defined as an emergency condition in which blood glucose concentration falls below the level necessary to properly support the body's needs for energy and stability throughout its cells. The plasma glucose is normally maintained at 3.6 to 5.8 millimole per liter, which is equivalent to 64 to 104 milligram per liter. Cognitive deterioration occurs at a level less than 3 millimole per liter, which is equivalent to 54 milligram per liter. But in diabetics, the threshold for symptoms can be very variable. And why is that? Because some of the diabetic, some of them can develop hypoglycemia unawareness or autonomic dysfunction, and most of the symptoms of hypoglycemia are autonomic symptoms, and this will be due to excessive exercise or delaying their meals. So some of them will not catch the symptoms of hypoglycemia until in a very low levels of glucose, and some of them get it at a level below 2.5 millimole per liter. And what causes hypoglycemia? Hypoglycemia is not only in diabetic, but in diabetic the most common cause is a relative imbalance between the administered versus the required insulin or oral hypoglycemic drugs. Okay, and this may result from undue or unforeseen exertion, insufficient or delayed food intake, and excessive insulin administration due to time, dose, or type of insulin. But we have other causes of hypoglycemia other than diabetes mellitus. We have endocrinological causes like pituitary insufficiency, we have adrenal like Addison disease, we have pancreatic like insulinomas, which is a tumor in the pancreas that secrete insulin, and we have like extra pancreatic tumors as well. We have liver failure can also cause hypoglycemia because we know that glucose is stored inside the liver in the form of glycogen, and when the body is fasting or delayed meal or anything, the body maintain the level of glucose through a process called glycogenolysis or gluconeogenesis as well. And those two procedures affect by liver failure. Also post-gastric surgery, malaria also can cause hypoglycemia. In historical basis, malaria thought to cause hypoglycemia only in severe malaria, but now this is obsolete because also simple malaria can affect glucose level and can cause hypoglycemia. Alcohol. In addition to alcohol directly causes hypoglycemia, the feature of hypoglycemia may be mistaken for alcohol intoxication or withdrawal. Actually, hypoglycemia can mimic any neurological presentation, including coma, seizures, acute confusion, or even isolated hemiparesis. So we always have to exclude hypoglycemia in any patient with coma, altered behavior, and neurological symptoms or signs. The suicide attempts, it can happen with large dose of insulin or oral hypoglycemic drugs. Some people can attempt suicide or homicide through these mechanisms. What are the signs and symptoms of hypoglycemia? As I mentioned before, it's autonomic symptoms. So we have sweating, pallor, tachycardia, hunger, trembling, altered mental state, loss of consciousness, irrational or violent behavior, seizures, focal neurological deficits like hemiplegia also can be caused by hypoglycemia. how we diagnose hypoglycemia. From the symptoms and signs, from the history and the past history of the patient, we can suspect hypoglycemia. But investigation-wise, when the patient arrives and immediately we do the ABCs, so this goes without saying, but we do RBG bedside and we find it less than 3 millimole per liter. This is hypoglycemia, so we need to start treatment immediately and we need to send proper samples for investigations before starting the treatment. Okay. What is the treatment of hypoglycemia? The treatment and management of hypoglycemia varies according to the level of consciousness and the cooperation of the patient himself. So when the patient is alert and cooperative, we can start treating it orally by encouraging the patient to take fast-acting carbohydrates and follow that by biscuits and milk. When the patient is unconscious, we start to give parenteral treatment. So, as I said, depends upon the conscious level and the degree of cooperation. I will start by giving fast acting carbohydrate, 5 to 15 grams, like glucosol, sugar lumps, dextrosols, followed by biscuits and milk. Also, it can be treated through glucagon, 1 gram subcutaneously, intramuscularly, or intravenously. And most of the time, the patient, before arriving to the emergency department, we can find him have this glucagon either by his relatives or by the ambulance crew. But we need to know that glucagon is not suitable for treatment of hypoglycemia due to sulfonylurea drugs, liver failure, or in chronic alcoholism. Why that? As there is maybe a little liver glycogen available for mobilization. The third way of managing hypoglycemia is through glucose 10% solution. We give 50 ml IV repeated at 1 to 2 minutes interval until we have one of two action. Either the patient is fully conscious or 250 ml has been given, which is equivalent to 25 grams of glucose. The glucose 50% solution, to give 25 to 50 ml out of it intravenously. But we need to know that this fluid is hypertonic and this is liable to damage the veins and no more effective than the glucose 10% according to Oxford Emergency Medicine. So if glucose 50% is used, give it into a large vein and follow with a saline flush to avoid the damage that can be caused to the veins. And we need to know that the time taken to return the consciousness and the incidence of nausea and vomiting and other adverse effects are similar for IV glucagon and glucose as well. When we have a persistence of altered level of consciousness despite treatment, what should we do? Okay. Persistence of an altered level of consciousness suggests another underlying pathology, like a stroke, or maybe reflect the development of cerebral edema due to hypoglycemia, which has a high mortality. So we need to maintain plasma glucose at 7 to 11 millimole per liter. We need to contact the ICU and we need to consider mannitol or dexamethasone. Why that? Because we are suspecting cerebral edema and we need to arrange for urgent investigation like CT scan and search for other causes of altered consciousness. I have mentioned this already. The overdose, when we have diabetic drugs overdose. So glucose infusion may be needed for 24 hours or longer after poisoning with insulin or oral hypoglycemic drugs. In insulin intoxication, block oxygen of the injection site has been used as a successful treatment of insulin overdose. And in those having sulfonylureas overdose, octreotide may be helpful in recurrent hypoglycemia due to overdose of sulfonylurea drugs. And we need to remember that octreotide is a somatostatin analog, and it works by inhibiting insulin secretion from the pancreas. And we know that sulfonylurea act by increasing secretion of the insulin by the pancreas. So octreotide blocks the effect of sulfonylurea. The discharge. We need to know that 90% of patients fully recover in 20 minutes, provided that the cause for the episode has been identified and fully corrected. It is reasonable to discharge the patient after observation in the emergency department with appropriate follow-up. And we need to arrange the follow-up having considered the following. Why did this episode occur? Had there been a recent change of regimen of the other drugs, alcohol, or any other causes precipitated this condition? Is the patient developing hypoglycemic unawareness or autonomic dysfunction? Because if this is true, this needs further management and counseling for the patient. And if the patient is a driver, we need to advise them to inform the driver and vehicle license agency of the hypoglycemic episode. That's all about hypoglycemia for now. If you have any questions, please put them in the comment section below. And if you benefit, even if a little bit of this, please like and subscribe and share this video to encourage me to do more videos. Bye bye.